If you're turning 65 soon or you're on Medicare, then you certainly have heard the term underwriting before. This is a term that's used in all forms of insurance, especially in health insurance and Medicare, which is why you're here. I do want to start this video by saying if you are somebody who's looking to find your options or to navigate your options when it comes to your Medicare options, please follow the information in the description of the video below so that you can talk to one of our experienced agents, because nothing beats talking to an agent about your options. This video is going to be great information for you, but that will always be the best thing to do. So for the next few moments, what I want to do is I want to take some time, use our T65 Compass to tell you about the different underwriting experiences that you could have when it comes to Medicare. So I want to start this video by talking about IEP and OE. Now, these two terms are initial enrollment period and open enrollment. We're talking about underwriting in this video, but the good news is when it comes to Medicare, the first time you ever go to Medicare, you're not going to really experience too much underwriting when it comes to one of your core options. And when I say core options, I'm talking about Medicare Supplements and Medicare Advantage plans. If you're going Medicare Supplement, a lot of people think about the underwriting that's associated with it, but in the beginning, you're not going to have to worry about underwriting. When it comes to going to Medicare, you don't have to worry about underwriting. So there's a couple terms here that I want to define that I want you to understand before we start talking about the underwriting guidelines specifically. We have IEP, which is initial enrollment period. This is the time frame that I can enroll into Medicare Part A, B, C, and D. I can enroll into A, B, C, and D with this time frame. And this is a 7-month window. That's a 7-month window that I have to enroll into A, B, C, and D. It's a 3-1-3-month window. It's 3 months before my 65th birth month, the month of my 65th birthday, and then 3 months after my 65th birth month that I can enroll into A, B, C, and D. And the best part about this is there is no underwriting, no health underwriting to enroll into any of these parts of Medicare. So we call these the parts of Medicare, the 4 parts of Medicare: Part A, Part B, Part C, and Part D. I do not have to go through health underwriting, meaning that my health will not keep me from qualifying for that coverage. There's no risk assessment on my health in order to enroll into one of these plans. Next, I have open enrollment. This is for Medicare Supplements. So we're going to put the term out here, MedSup, Medicare Supplements, MedSup. And this is a 12-month window, that is on either side, 6 months on either side of my Part B effective date, that I can enroll into a Medicare Supplement plan with no underwriting. Again, there's no underwriting. With both of these time frames, IEP and OE, I could have an active cancer diagnosis, and the product that I'm wanting to enroll into will have to let me enroll into their plan with no health guidelines, no health questions that I have to answer. It doesn't matter if I'm actively about to get a surgery. I can be enrolled into this plan without having to answer health questions. And IEP is for parts A, B, C, and D. Open enrollment is for Medicare Supplement. So both things you need to be aware of. Next is guaranteed issued. This one's a little harder to define because guaranteed issued can mean a product has no underwriting at all, like a dental, vision, hearing plan, or it can be a term that we use for Medicare Supplements. If I were to take my Medicare when I turned 65, but I kept creditable coverage, and then 10 years later I decided to get off that creditable coverage and now I want to get on a Medicare Supplement plan, I actually have a guaranteed issued right. I have a guaranteed issued period that I can enroll into a Medicare Supplement plan with no underwriting, even though I'm outside of my open enrollment because I already activated my Part B. So I have a guaranteed issued window here that I can enroll into a Medicare Supplement plan, and that period is about 2 months that I can enroll into a Medicare Supplement plan with no questions asked. The difference between guaranteed issued and open enrollment is open enrollment, I can actually freely choose which Medicare Supplement plan I want. Guaranteed issued, I have to take Plan F or Plan G depending on when my Medicare effective date was. And then under here I have UW. That's the point of this video, is underwriting. Next is underwriting. If I've missed these time frames, I would have to use underwriting to enroll into a Medicare Supplement plan. Now, it's very important to understand Part A, B, C, and D, they never require underwriting, ever. never require underwriting. You are always able to enroll into Part A, B, C, and D no matter what your health looks like. They are based off time periods or special conditions that would open up a time frame for you to enroll into. So these are conditioned by time. Medicare supplements are conditioned by underwriting. So majority of the underwriting you're going to experience as you make your Medicare decisions is going to be based on the Medicare supplement. So common underwriting guidelines, that's what I want to talk about. We're really talking to people who are making a decision to go to Medicare supplement plans, and most of you, that's what you will do because you don't like putting up with networks, you don't like putting up with prior authorizations, you don't like having to go under managed care. You want a plan that's going to let you conveniently use your doctors and let them make the decisions for you. That's exactly why you're watching this video, and you need to understand some of the common underwriting guidelines that you could face if you miss these time frames. If you miss that time frame and now you have to go in through underwriting, you got to go through a process of the insurance company deciding that they're willing to take on the risk of your health, right? And so just to be very clear, there's a lot more than 5 conditions that we're going to talk about. I'm going to give you the top 5 that can keep you from being able to get a Medicare supplement later on. But I want you to understand that a lot of these applications ask 60 to 70 questions about health in order to determine if you are healthy enough for them to take on the risk. But I'm going to give you the top 5 conditions that keep people from being able to get into a Medicare supplement plan after their open enrollment. And the reason I'm doing this is I want you to understand how important it is to complete your enrollment in a timely fashion so you don't have to worry about these. Number 1, major heart conditions. Major heart conditions. Now, I'm not talking about blood pressure or cholesterol. What I'm talking about here is things like recent heart attack, recent strokes, TIAs. AFib is a major one that gets us, but most importantly, heart failure, heart disease. Those are the types of diseases, those are the types of conditions that will really stop you from getting a Medicare supplement plan through underwriting, right? If I have any of those major heart conditions, it can really keep me from getting a Medicare supplement plan, or at the very least, I can get one and I'm going to pay triple what it would normally cost, right? So if I have any kind of major heart conditions, it's very important that I get enrolled into my Medicare supplement plan in a timely fashion in that open enrollment period. I need to do it in that time frame so that I do not have to go through the underwriting if I have a major heart condition. If you have AFib, you're taking Eliquis for it, you certainly need to get that done in that time frame, because not only is it major heart conditions, it's taking medicines for major heart conditions. If I'm taking Eliquis, even if I'm not actively diagnosed with AFib, I could still be declined by these Medicare supplement companies if I'm not in that open enrollment, right? The next one here, it's a pretty fairly easy one to guess, is cancer. If I have any kind of cancer, that can certainly keep me from getting a Medicare supplement plan. And the thing about cancer is maybe I'm cancer-free for 2 years. A lot of these carriers are going to make sure that you're cancer-free for 3 or more years, meaning that I don't take any medicines for cancer, I'm not receiving any treatments. If I have any of that going on, it can certainly keep me from enrolling into a Medicare supplement plan. Again, this is all just to affirm that you need to get this done in your open enrollment. Next is going to be diabetes with complications. Diabetes with complications. And this one is actually pretty common. Lots of people have diabetes, especially when you turn 65. A lot of people have diabetes with complications. When I say complications, I mean retinopathy or neuropathy. If I have either of those complications with diabetes, these Medicare supplement companies will deny my application for their coverage. Now, if I'm in my open enrollment period, nothing to worry about. And when I say with complications, it can also just mean with insulin. If I'm diabetic and I'm having to use insulin, some of these Medicare supplement companies will decline your application due to diabetes with insulin. So it's very important that you get this done in a timely fashion. Next is upcoming services. Upcoming services. A lot of people try to go and get coverage because they're about to have an upcoming surgery or they have physical therapy coming up, and they think, oh, let me go get my coverage put in place. Well, a part of the underwriting for Medicare supplements is if I have any kind of service that's been scheduled in the next 12 months, like a surgery or therapy, I'm not going to get approved for that plan. And if I do get approved, somehow I get through the cracks and I get approved, and then I have that service completed, and they go back and check it on the back end, they can rescind my coverage, which means that I went to the doctor thinking I had coverage, and now they're not going to pay for that, and they're going to eliminate my coverage. They're going to keep me off the plan. So if you have any upcoming services, that can actually get you declined for a new Medicare supplement policy. So you can't wait until it's time to use it. These are policies that you have to get ahead of time before your health starts to deteriorate. And then the last one here is immobility. Immobility. If I'm in a wheelchair, or I'm using a walker or a cane, or I'm bedridden, whatever, if I don't have the ability to walk, a lot of these Medicare supplement companies are not going to approve my coverage. They will decline my coverage. So again, I'm just really writing these up here for you to see it is a pretty common thing to have a condition that these Medicare supplement companies will decline. So you need to get this done in a timely fashion in that open enrollment, 6 months on either side of your Part B effective date. Now let's talk about some other products that have underwriting. So we talked about Medicare Supplement. That's the big one that you're all curious about. But let's talk about some other products you need to consider that will have underwriting. Good news is Part A, B, C, and D, no health underwriting. We're good there. They're all just conditioned by the time period. There's no underwriting with those. But I do have other products that you need to consider that do have underwriting. Maybe we're going to get something called a CHAS product. That's cancer, heart attack, and stroke. This is a lump sum policy for cancer, heart attack, and stroke. And if I'm getting one of these plans, I will go through underwriting. The good news is it's only going to ask underwriting questions for cancer, heart attack, and stroke. If I don't have one of those conditions, then typically I'm good to go and I can get in that. Maybe I need a short-term care policy, something like a recovery care or home health care, home health aid. You want something of that nature that will require underwriting. Maybe I want to go and get a hospital indemnity plan with my Medicare Advantage plan. Even though Medicare Advantage plans don't require underwriting, hospital indemnity plans do. And so I maybe need to go through underwriting when I turn 65 for that. A lot of hospital indemnity plans, though, thankfully, do have guaranteed issue periods when you're turning 65. So that's good news. You can actually get into some of those with some kind of guaranteed issue, but a lot of times I do have to go through underwriting. Another type of product that I may have to go through underwriting for if I were turning 65 would be something like an annuity. This one's a little complex because annuities are actually going to be less health underwriting. They're not going to be health underwriting. They're going to be financial underwriting. The underwriter for annuities are going to make sure that you actually are going to have enough liquidity in your accounts and your retirement accounts and your assets to even give you this product. So maybe you're somebody who's a 401k, has a 401k and it's maturing, and you want to talk about getting some kind of product like an annuity that you get an automatic return on each year, guaranteed return on each year. The carrier is going to make sure that you have the liquidity necessary for that. So that's something you need to keep in mind. It's not always just health underwriting that we're talking about. It can be other kind of underwriting. And then the last one for health underwriting would be life, some kind of life insurance. A lot of times we're writing final expense policies for our customers, and they have to go through health underwriting to make sure they qualify for a life insurance policy. So there's other products. It's just not your Medicare supplement that you got to consider. It's not Medicare Advantage you only have to consider. It's not drug plans you have to consider. There's lots of products that you have to consider that have underwriting, and you need to understand them. What's most important is that you talk to an agent that understands the underwriting of these products and can give you a great experience taking you through the underwriting and get it done in a timely fashion so that underwriting doesn't come back to be a burden or curse for you. That's the biggest part of this. So please follow the information in the description of the video below to talk to one of our agents today so they can help you through these underwriting guidelines. Listen, Medicare is a journey. We're a compass. Use it.